Semester 6 is over.
Okay, great. Fine. So I'll start sharing this screen. Okay, so parenterals कब पढ़ा है तुम लोगों ने?
Semester 5.
Have you all studied parenterals in college? You all obviously have.
Yes,
So
ma'am.
also, yeah. Also, tell me, do you all have? Yeah. Also, tell me, do you all have this thing? Do you all have the MCQ booklet with you all?
Yes, ma'am.
Yes, ma'am.
Yes.
सबके पास है, right? Okay, fine. So keep that with you all. We at the end of the class we'll solve some MCQs from that. And उसमें answers पीछे नहीं है, correct? Okay, yeah, fine. Tell me, what have you all studied in parenterals? Excuse me.
Ma'am, sterile
What?
these are sterile liquid dosages addition.
I can't hear you. Be loud. I can't hear you. Come on, tell me.
Route of administration.
Route of administration. Okay. And
Advantages, disadvantages.
okay, fine.
Various
Then-
types of formulations.
Ma'am,
Various
formulation.
Formulation,
types of, such as
injections, ophthalmic solutions.
ophthalmic solutions you've studied in parenterals. Yeah, can you all hear me? Can you all hear me?
Yes, ma'am.
Yeah, injections given in the eye is one thing, and ophthalmic solutions is another thing. Okay, so parenterals में eye drops की बात नहीं कर रहे. Ophthalmic injections is yes. So Shubham, did you understand the difference between the two?
Yes, ma'am.
Okay, and और किसने बोला था different routes of administration? Who answered that? Divya answered it, right?
No, ma'am.
Who answered it then? Which are the different routes of administration then? In parenterals?
Intradermal, intrathecal.
Intradermal, intrathecal.
IV.
IV is one. Correct. So these are the different routes. And what else have you all studied? The different excipients and all used, correct?
Yes, ma'am.
Yeah, different excipients used. कौन से important excipients लगते हैं? The packaging material which is so important, right? Different types of glasses, type 1, type 2. उसमें कौन से tests करते हैं? That, right? These things we've studied, right? And then how are the formulations made, the different sterilization techniques and all of that. Okay, so here again we'll be studying these different topics within Parenterals. It's a big topic. We might take 3 lectures to complete this. All right. We will also discuss about tonicity, isotonicity, and all of that. We will also solve numericals. वो सब आता है तुम लोग को numericals on isotonicity and all?
नहीं मैम.
No, ma'am.
Okay, fine. Then we'll solve that. Probably in next class or the last class, we'll take up the numericals. Fine. So in today's class, we shall discuss an overview of parenterals, the different routes of administration, different types of parenterals, and time permits, we'll also extend it into the different excipients. All right. So what I want you all to have right now, like notes जो लिखने हैं उसके लिए book and pen obviously, and keep your MCQ booklet also ready. Fine. And I don't think there's a chat box here, right? Is there a chat box here?
No, ma'am.
There's no chat box here, right? Then I'll randomly pick up any of you and ask you all questions based on. And I hope you all know that there's an assignment also after this, right? Are you all aware about it?
Yes, ma'am.
Yes. Fine. So I shall upload 2 questions maybe by tonight or by tomorrow morning. You all will get a notification on the application and you all are supposed to solve that. Okay, it will be based on today's lecture only. Fine. Anybody has any doubts, you all can unmute your mic and ask me then and there. All right. Fine. So let's begin. First, let me know if you all can. Can you all see the screen?
Yes, ma'am.
Is it completely visible, all of it? कि कुछ hidden वगैरह है?
मैम बराबर है.
Just a minute. I'll not. Okay, so you all can see the full screen, right?
Yes, ma'am.
Okay, good. So any doubts, please unmute yourself and ask me the question then and there. So yeah, in the first part, we shall discuss about the fundamentals, all right? So what do you understand by parenterals? They are something. So this is your regular GI route, right? This is your regular gastrointestinal route. So any formulation which is given beyond this, okay? This is your normal GI gastrointestinal route. Any formulation, and that is why it's called enteral administration, okay? It comes from the word gastrointestinal. Okay, gastrointestinal, say you get this enteral. So this is enteral route of administration. Anything beyond that is called parenteral route of administration. So whenever you have any injection, be it injection in the eye, be it injection in your layers of the skin, or directly inside the tissue. Okay, all of this comes under parenteral administration. Fine. And parenteral administration, when we say, it has to be given in form of an injection. Okay, it can be an injection or also an implant. And when I say injection, it definitely also includes infusion. Can you all see the ink on the screen? ये yellow pen का दिख रहा है तुम लोगों को? Yes?
Yes, ma'am.
Okay. Yeah, if you all have any issues with the sound also, let me know, okay? Yeah. So this what is parenteral is. So it comes from the Greek word which means para, broken down into para and entron. Entron matlab your intestine and par matlab other than that. Other than your intestine, जो root जिस तरीके से हम दे सकते हैं, administration कर सकते हैं medicaments का, that is called parenteral. Okay. And as I told you all, they are administered by either injection, infusion or implants. Implants also, it directly goes in the tissue. Okay. So you can either have a subdermal implant. Okay. जहाँ पे skin का थोड़ा layer खोल के dermis में हम implant देते हैं. Okay. So these are the things. Infusion, injections, so you all understand, everyone, the कोविड के टाइम जो वैक्सीन दिया था, दैट वाज वन बोलस इंजेक्शन. ओके, इट वाज अ बोलस इंजेक्शन बिकॉज वो एक शॉट में ही दिया था. इन्फ्यूजन का मतलब पता है सबको?
पर्टिकुलर टाइम,
क्या
पर्टिकुलर टाइम पीरियड पे देते हैं इंजेक्शन?
नहीं, इन्फ्यूजन इज द ड्रिप सिस्टम. जो हॉस्पिटल में ऐसे ड्रिप सिस्टम लगाते हैं, करेक्ट? Like if the patient is lying here, sorry for my drawing, the patient is lying here, उसके हाथ पे ये drip system लगाते हैं, correct? Okay, the nurse comes and injects here. ये dilution bag होता है, NaCl या dextrose या whatever का. Okay, so this system is called as an IV infusion system. It directly goes in the venous system, intravenous infusion system. समझा सबको? And how does parenteral differ from other dosage forms? Because they are injected directly into the body tissue. Okay, it directly goes in the body tissue. Okay, through the primary protective systems of the body, like your skin, mucous membrane. उन सबको पार करके directly goes in your body tissue. That tissue can be your blood. Blood is also a connective tissue, right? It can be your dermal tissue. It can be some organ tissue. All right. And because वो primary protective system को पार करके जाता है, because it directly enters your tissue, they must be exceptionally pure, free from any physical, chemical or biological contaminants, which means it must be sterile. Very important. Okay, why must it be sterile? Why should it be sterile? Because
The doses are irreversible. If any kind of contaminants happen, then it is difficult to remove.
but the answer, it must be sterile because it's directly going into the tissues, directly going into the system. All right. When you have a tablet directly body के अंदर नहीं जाता. If you understand, your GI system is nothing but a passage. Okay, it is a hollow tunnel like passage with two openings, right? Your body tissues are not like that. So इधर अगर तुम stomach में तुम्हारा tablet जाएगा, the acids and all will neutralize any bacteria or any contamination. All right, जो भी important होगा वही तुम्हारे इंटेस्टाइन से बॉडी के अंदर एब्जॉर्ब होगा सॉरी स्मॉल इंटेस्टाइन से एब्जॉर्ब होगा. That is not the case with parenterals. In parenterals, it's directly going in your body tissue. That is why it must be sterile. Okay, so that you need to answer it accordingly. Fine. Should we move on?
Yes.
Yeah. All right. So parenterals are nothing but sterile preparations. This is a keyword which is intended for administration under or through one or more layers of the skin or mucous membrane. Fine. So which are the important characteristics? This is very important. It can come in type of an MCQ, assertive type of questions. पता है ना तुम लोग को? मतलब they will give P as one statement and Q as a reason. They will give if P is the answer, reason for Q is the reason for P or not. Okay. वैसे type का questions भी आ सकता है. So these characteristics are very important. So the first one is all products must be sterile. All right, we've discussed that why they must be sterile. Second, all products must be free from pyrogenic endotoxin contamination. What is a pyrogen?
Metabolites of
Ma'am, which
bacteria.
increases
Body temperature.
Yes, yes. I could hear two people answering. It's right. Not a complete definition, but right. We'll discuss pyrogen in detail in the upcoming slide. Okay. So they must be free from pyrogenic contamination. Otherwise, agar pyrogen hoga, to what will happen?
increase the body temperature.
What is it called? What is it called? It's called from P only. Rutuja, increase in body temperature. क्या बोलेंगे उसको?
Pyrexia, ma'am.
क्या?
Pyrexia.
Pyrexia, correct. Okay. Pyrexia. Okay, all products must be free from pyrogenic contamination. They must also be free from any visible particulate matter. Pyrogens तो हमें आंखों से दिखाई नहीं देगा, करेक्ट? उसके लिए हम टेस्ट करेंगे. कौन सा टेस्ट करते हैं for pyrogens?
Sham test and Lal test.
लाल टेस्ट.
करेक्ट. लाल टेस्ट, BET भी बोलते हैं, करेक्ट? Bacterial endotoxin test. All right, we shall discuss these tests in the next lecture. All right, the important tests. So these are the important tests, right? Then it should be free from visible particulate matter. How will you test this? इसमें ही इसका आंसर है. Visible particulate matter को कैसे टेस्ट करेंगे? Very simple.
मैम वो उसको कॉन्ट्रास्टिंग कलर के साथ उसको चेक करके.
हाँ, not contrasting color, black and white background के against you will keep. Okay. So जो भी ampules या vials होगा, okay, उसको एक बार you will place, and if this is like the background, right? एक बार you will place it in front of a black background, see if there's any particulate matter, and once you will keep it in front of a white background. Okay, so black and white background के against you will test. Visually देखोगे कि particulate matter है कि नहीं. Okay, so against black and white background, and it is tested visually. I hope you all are writing simultaneously. Okay, and for all of this, कि pyrogen नहीं होना चाहिए, sterile होना चाहिए. For all of this to meet, हम raw materials ही ऐसे लेंगे जो high quality के होंगे. So you will take API and excipients which have highest level of purity. Okay. So when you talk to vendors, okay, my PhD project is entirely on parenterals, right? So whenever I'm making a non-aqueous or an aqueous type of formulation. I'm not talking about the rocket science of nanoparticles and all. Simple solutions and all भी जब हम बनाते हैं उसके लिए suppose हम लोग को NaCl चाहिए रहता है. I'm just giving you all an example. या फिर let's say propylene glycol चाहिए रहता है. Okay? Propylene glycol चाहिए रहता है. If I go to the website of the vendor, there will be two grades of propylene glycol. One is the regular grade and one is the parenteral grade. So parenteral grade is more pure, it's more sophisticated, it has less microbial load, less to nil microbial load. Okay, nahi hota hai usme. And so these are the two different quality of two different grades of one item which you get usually. Okay, so jo tum API, that is your main drug, and excipients use karte ho, they must be of highest level of purity. At times what happens is to say, and because they are of high quality, it's very expensive also. Okay, it's very expensive if you buy parenteral grade of excipients. So at times to save on cost, या फिर there are some excipients which are not available in parenteral grade. Okay, वो specifications meet नहीं करता है. So what do the manufacturers do is they will take the normal grade of excipients and उसको last में TS करेंगे. TS मतलब terminal sterilization करेंगे. Okay, so it is like तुम either सब कुछ sterile and pure grade का लो and mix it in aseptic condition. Okay, you take everything pure and sterile and then process it under aseptic condition, aseptic condition, and you get your product. And the product which you get is again sterile. Or if you don't have this, अगर ये नहीं है तुम्हारे पास, then you take your normal grade of excipients. Okay, you take your normal grade of excipients, process it also normally, obviously in class 100 area, ये भी हम पढ़ेंगे, the different class areas. Each and every slide in this topic is very important, huh? And then उसको last में हम terminal sterilization करेंगे, either autoclave करेंगे या फिर cold sterilization करेंगे. Cold sterilization is nothing but filtration. Okay, we shall study the different sterilization techniques at the end. And then what you obtain is again the same. All right, so did you all get the two different ways of making a product?
Yes, ma'am.
Good. Everybody with me?
Yes,
Yes, ma'am.
All right, good. Okay, so this is the thing. ये अभी तक हमने product and excipients का बात कर दिया. अभी product का quality क्या होना चाहिए besides sterile? It must be isotonic in nature. Can I erase this? What's written on the screen? Have you all written it down?
Just a moment, ma'am.
मैंने इधर बस sterile product लिखा. Okay, so the next point is what? That your product must be isotonic. Can anybody tell me what is isotonic?
ma'am. Same osmotic pressure.
Same.
Osmotic pressure.
Correct. Same osmotic pressure. And why should it be isotonic? Why should your parenteral products be isotonic?
Because we are directly administrating into our body system.
Okay. And अगर isotonic नहीं हुआ
Ma'am,
तो
to
क्या
pre-
होगा?
To
Blood
prevent
के साथ
हम
भी
ज्यादा
iso-
पेन
Dhanashri, can you answer?
Ma'am, it should be isotonic with the blood.
If it's not isotonic, then what will happen?
हम ज्यादा
the
पेन
cell
जनरेट करेगा.
हाँ, कोई तो बोल रहा था the cell what? Who was that?
मैम
मैम या तो
रक्तस्राव
स्लिम होगा या
आदि
तो स्मल हो जाएगा.
Two people are speaking together. How should I can't understand who's speaking what. Malika, go ahead. And please,
मैम इसको हेमोलाइसिस ना करना,
क्या क्या
हेमोलाइसिस ना.
Okay, hemolysis होगा, right? There'll be like, because if the tonicity is not proper, then if it's not isotonic, either the cells will shrivel or they will become turgid and they will undergo lysis, hemolysis, right? So this is what isotonicity is, and this is what will happen if the solutions are not isotonic. Anybody wants to add anything else to this? Suraj, you were saying something.
No, ma'am, I was saying the same to prevent swelling and shrinking of cells.
Yeah, right. That is why you have different tonicity adjusters and all of that, NaCl, dextrose, and all of that. Okay. Kitna molarity, concentration ka NaCl, dextrose use karna is very important. We shall take up isotonicity, tonicity modifiers, and all of that separately in the upcoming lecture with the numericals. Just a minute. Okay, fine. Okay. Moving on to the next. Yeah, I'm just taking this off the screen. Then comes, अभी तुमने product तो बराबर बना दिया, but तुम packaging कैसे कर रहे हो उसका? That also plays an important role. So the next point is that the container and closure system must also have a low extractable and leachable profile. कि तुमने product तो एक glass vial में भर दिया, but what if that glass is only leaching out minerals, okay, or some ions, okay? So those things must not be a problem with your product. So the container, even the rubber stoppers which you are using, they must have low to nil extractable and leachable profile. Okay? That all products must be chemically, physically, and microbiologically stable. All products matlab all the components, all your excipients, all the API, वो एक दूसरे के साथ compatible होने चाहिए. Okay, so the 7th point is about compatibility. Okay, all the excipients, then your API, then your container and closure system, they all must be compatible. They must be chemically, physically, microbiologically stable and also inert. Okay, उनका खुद का कुछ reactivity नहीं होना चाहिए, especially container closures का. API को छोड़ के other things must be inert. Then the 8th point is, yeah, product must be compatible even with the, ये तो आपस में, okay, now ये एक vial का जो content है, ये हमने उसकी बात कर दी. Vial का content should be compatible with each other. But now suppose ये vial को हम वो dilution bag में dilute कर रहे हैं, वो जो infusion bag मैंने बताया, okay, उसके साथ हम dilute कर रहे हैं. So it must be compatible with that, those things also, compatible with your IV diluents, with your delivery system, other drug products, okay, all of these things. हर एक component को एक दूसरे के साथ compatibility होनी चाहिए. And the 9th point and the most important point is formulation must contain few and simplest excipients possible. Okay, an industry will always prefer making a solution which is very simple. You know which is the most ideal solution, ideal formulation is just drug and water. Drug plus pani is the best. Easy to make, water is easily available, easy to make. Yeah, it must be WFI, obviously, water for injection, but it's the simplest formulation. यहाँ पे जब प्रॉब्लम आने लगती है, देन एक एक करके एक्सिपिएंट्स ऐड करे जाते हैं. स्टेबिलिटी इश्यूज आया, ओके, या फिर ड्रग डेग्रेडेशन इश्यूज आया, तब जाके other excipients play a role. But the ideal and the most favorable type of formulation is API and water. So that this is what is being said here. It must contain few and simplest excipients as possible. Everybody clear with all these points? Did you all sleep? Hello.
Yes, ma'am, clear.
Clear. Okay, fine. So then we were talking about pyrogens, right? So this is what pyrogens are. They are either metabolic products of microorganisms or they are the dead microbes themselves. Okay? Metabolic products है वरना dead microbes themselves है. And they are their nature is lipopolysaccharide in nature. All right? They are not very good. The lipid part is the one which causes pharmacological action. And the polysaccharide माने के sugar based part. Okay? That is water soluble. So because of this, the pyrogens are actually water soluble. Okay, because of this, they are water soluble. So because they are water soluble, can we filter pyrogens? Can we filter pyrogens?
No, ma'am.
No. And they are also thermostable. Water soluble bhi hai and thermostable bhi hai. So can we heat and kill them?
No, ma'am.
Then how are pyrogens filtered? How is the water? And they are present in water, right? So how is the water made free from pyrogens? Hint is that they are non-volatile.
Distillation.
Correct. You use the process of distillation. Okay. Distillation करोगे तो क्या होगा? सारा water evaporate होगा. And because pyrogens are non-volatile, वो evaporate नहीं होंगे. Pyrogens won't be evaporated. Only water will be evaporated. And you will get pure water. Okay. So they are water. Because of this, distillation is the process जिससे तुम water for injection बनाते हो. And then उस water को जो तुम tank SS मतलब stainless steel के tanks में भरोगे वो water WFI and it is kept under constant stirring. Constant stirring में रखा जाता है and it is under UV light. Okay, it is constantly under UV light. So it's a UV protected SS water tank. Okay. And as I said, if pyrogens are present, they will cause pyrexia. Pyrexia is nothing but increase in body temperature, vasoconstriction, chills hoga. And this is the molecular weight of pyrogens. So that is why, because of the molecular weight and water solubility, it cannot be filtered, it cannot be autoclaved, it cannot be heated and killed. Okay, only distillation or double distillation can be used. Fine. So now इतना सब हमने देखा पैरेंट्रल्स का कितना सारा झंझट होता है. Okay? In spite of that, why do we like? What's the need for this, right? There are so many disadvantages. First, let us look at the disadvantages of parenteral products. First is whenever you administer parenteral products, it's difficult to administer, it is painful, and it causes discomfort. Okay, it's also difficult to administer, right? Because it's an evasive method. Evasive, or you can also say it's an invasive method. Okay. Then it's very expensive to manufacture, and also the rules to to manufacture this, they are very stringent because it has to be made sterile. मैंने last slide में तुम लोग को process बताया ना कैसे manufacture करते हैं, right? It has to undergo aseptic processing and all of that. Okay. Also, the entire setup for parenterals is very tedious to maintain and all, just because we have to maintain sterility. So there's so many disadvantages. Then sterilization or aseptic techniques in compounding, matlab in the manufacturing of the product. Okay, compounding, manufacturing, handling. Even when you are dispensing the drug, each and every step must be done in a way that it is aseptic and sterilized. Even while administering it to the patients को देते वक्त भी you should make sure that the syringes and everything are aseptic or are sterilized. And the administration requires trained professionals. Okay. Yeah, there are some injections like the regular insulin and all which we can take by ourselves. But zyadatar you need trained professionals. Training them, again, it's cost inducive and all, right? And greater risk for infections or injury if they are not administered properly. Say example for ophthalmic injections. Okay, for ophthalmic injections it's so difficult, so important to be precise. And do you all know what are nosocomial infections? Anyone?
Yes, ma'am.
What is nosocomial?
And a hospital-acquired infection.
Yeah, matlab the infections which happen during you being treated. Suppose somebody is admitted in an ICU and उसको कोई infusion चढ़ा रहा है, but अगर वो infusion में ही contamination हो, although he is being treated for blood cardiac problems, but वो infusion में कुछ infection उसको आ जाए तो उसको maybe कोई microbial infection या viral या fungal infection हो सकता है. So those acquired infections while treatment in hospital are called nosocomial infections. So isn't it obvious कि parenteral administration करने के वक्त ऐसी problems हो सकती है, right? So these are the different problems associated to parenteral route of administration. All right. Please make a note of this term nosocomial infections. Huh?
Hey, Mama.
So, in spite of these issues, in spite of these infections, these disadvantages, there are several advantages and very crucial advantages जिसके वजह से parenterals are preferred. They are preferred to a very great extent actually. First and the most simplest reason is that parenterals provide. Hello.
Hello, ma'am. Can you go return back to that disadvantage one slide?
What happened?
Ma'am, done. I was writing and the last point was remaining.
Going to get these PPTs, so don't worry about that. PPTs मिलेगा, मैं बस जो बोल रही हूँ, make a note of that. Don't write what is there in the slides, that you are getting it. Okay. So the first and the more simplest advantage is they provide a localized effect. Okay. So for example, like I had braces during my bachelor's. Okay. So I had to undergo tooth removal every 4 times. I had to undergo tooth removal. So during that process, अगर डॉक्टर मुझे टैबलेट देगा, उसको numb बस jaw area करना है, correct? Only that portion has to be numb. So can it be easily achieved by an oral route of administration by a tablet? No. It's better if it gives me injection, local anesthetic at that particular place to numb that place. All right. So for localized effect, parenterals are handy. All right. Then for delivering drugs with poor bioavailability, obviously, Now,
Ma'am,
yes.
can't see the slide for advantages.
Yeah.
Ma'am, we are still on the disadvantage slide.
Okay, it has not gone to advantages. Just a minute. Let me stop and start sharing. Can you see now? Advantages दिखाई दिया? Hello.
Ma'am,
Yeah, can you see now?
No, ma'am.
ma'am,
No, ma'am.
You can't see the slides now also.
No, ma'am.
Still showing disadvantages.
ma'am, we can't see the slides anymore.
Huh?
No slides, ma'am.
Okay. Just a minute. Just a minute. Can you see now?
No, ma'am.
अभी भी नहीं दिखाई दे रहा है advantages?
No, ma'am.
पूरा blank.
पूरा
No, ma'am.
What I'll do is I'll leave the meeting and rejoin again. Okay, so just give me a moment. Just give me a moment. Okay, now tell me if you all can see this thing. Can you all
Yes,
see
ma'am.
this? अभी दिख रहा है? Advantages?
Yes, ma'am.
Okay. So first, it will provide a localized effect. Second, it will help in delivering drugs with poor bioavailability. ठीक है? मतलब अभी orally कुछ drug oral formulations won't be 100% bioavailable, right? Bioavailability क्या होता है? Amount of drug reaching blood, okay, from the site of administration. Site of administration से blood में कितना percentage of drug पहुंच रहा है, that is called as bioavailability. Abhi, when you are giving it orally, so not all of it will reach blood, correct? It will undergo first pass metabolism. Okay, first pass metabolism. It will undergo degradation in the GI tract. Okay, so delivery of drugs which may degrade the which may be degraded in the GIT. ये सब problem होगा. But instead, if you give something which is say intravenous directly, which is going in the blood, तो इसका bioavailability कितना होगा intravenous administration का?
100%.
100%.
100%.
So isn't it useful for the drugs जिनका poor bioavailability होता है या फिर जो GIT में degrade हो जाता है? Obviously it is helpful. Okay, ये तो हमने intravenous की बात कर दी. Otherwise it can be given intramuscularly also. Intramuscularly it won't undergo first pass. Okay, you can give you can give in subcutaneous जहाँ से वो it can be taken up in lymphatic system also. Okay, so all these things adds up to the advantages of your parenteral formulation. Then IV में तुम्हें immediate, because there is 100% bioavailability and because it goes directly in the blood. We are talking about IV, intravenous. Because it goes directly in the blood, there will be an immediate therapeutic effect. Fast distribution हो जाएगा, rapid onset of action हो जाएगा. So in cases of emergency, these are the go-to route, correct? Emergency में this can be useful. Anaphylactic reaction होता है तो epinephrine के shots देते हैं. Epinephrine के shots देते हैं. It's an auto injector. It's available in form of an auto injector. So वो directly ऐसे auto injector होता है and directly ऐसे stab करते हैं. कहाँ पे? Either in the your upper muscle here on the arm or on your thighs. Okay, or near the buttocks. उधर auto injector देते हैं. And इसका नाम epinephrine auto injector का brand name is EpiPen. EpiPen. Another one is EpiPen Junior. इसमें कम doses होता है. EpiPen Junior में थोड़ा कम dose होता है. Fine. So this is for emergency cases of anaphylactic reaction. Anaphylaxis. Fine. The next point is that I hope you all have written this thing. EpiPen वाला point लिखा सबने?
Yes.
Good. I'll come to this point later. Yeah. Then, so we've covered up 3, 4 points. I'll come to the 6th point first. Okay. 6th point is it is helpful to administer drugs to unconscious patients. You can't expect patients who have undergone some major surgery or some accident or some, in cases of emergency to take up and swallow a tablet, right? So tabhi these parenteral route of administration becomes very important. Also to deliver TPN, that is TPN का मतलब पता है? Total parenteral nutrition. Okay. Total parenteral nutrition to babies, or also in case of major surgery when patients cannot take food, तो उनको total parenteral nutrition देते हैं, and that is given in form of IV only. Okay, it's basically an emulsion. It's basically an oil and water emulsion, TPN. Fine. Now coming to point 5. I hope you all have written this. Coming to point 5. Now to have a prolonged release, okay, prolonged drug release में depot systems तुम जब बनाते हो, that is administered through IM or SC route, correct? Have you all attended my thixotropy lecture? Hello. Hello.
Okay.
No. Thixotropy में मैंने बोला है ना कि solution बाद में gel बन जाता है when you apply, like gel को shear apply करो तो solution बनता है and then again rest में वो gel बन जाता है. So when you are giving some thixotropic systems like these. Okay, in situ, इसको क्या बोलते हैं? In situ gel. Okay, in situ gel या in situ implant. मतलब बॉडी में जाने के बाद वो जेलिफाई होगा या बॉडी में जाने के बाद वो इम्प्लांट फॉर्म होगा. So when you administer it, it's like a solution, and then when it goes to your dermis or subcutaneous layer or your muscle, okay, it will form a gel. And वो gel बन के क्या बनेगा? Gel बन के it will form a depot, okay? And depot में से what you can see here, धीरे धीरे drug release होगा, and that will give you a prolonged drug release. So उसमें भी तुम्हारा IV ही use होता है, okay, in such cases. So these are the several advantages where parenteral is very much used. All right. Did you all understand this? Any
Yes,
doubts here? Anyone? Okay, so I think I can move ahead then. Girls, are you all with me?
Yes, ma'am.
Okay. Okay, so now we've understood what parenterals are. Now let us understand the different types and the various classifications. जैसे तुम लोग बोल रहे थे ना, different types, suspensions, emulsions होते हैं, different classifications माने कि different उसके route of administrations हो गए. Okay, so all of that let us discuss. So these are the 11 different routes of parenteral administration. You have intravenous, which directly goes in the venous, as the name suggests, and it can be given in form of an injection, यानी कि bolus, मतलब एक shot में, okay, 1 ml या 2 ml का एक shot, और infusion. Infusion are large volume parenterals, LVPs होते जिसमें liters of solutions दिया जाता है, 500 ml, 1 liter, okay. TPN जो बोल रहे हैं हम, okay, जो TPN बोल रही थी ना, TPN बोल रही थी, TPN is given intravenous infusion form. All right. Then intravenous का opposite, easy to remember, is intra-arterial, जो तुम्हारा arteries में दिया जाएगा, right? And I'm giving, explaining you all in the order of how you need to remember, okay? So in venous हो गया, arteries हो गया, and directly your heart. So intracardiac हो गया, ठीक है? Then जो हमें पता है, the different layers of the skin, okay? You have intradermal. Okay? These all are the sites where it's being administered. Subcutaneous, intramuscular. Also remember these short forms, huh? Don't get confused with these short forms. Exam में अगर short form आएगा, you need to know कौन सा वाला क्या होता है. All right. Then you have, so हमने skin and heart cover कर दिया. Then let's go to central nervous system. Central nervous system में you have intraspinal, intrathecal, intracisternal and epidural. Okay. Then we'll go to eye, ophthalmic injections. Okay. Then intrapleural is, pleural cavity कहाँ आती है? कौन से organ में?
lung.
Lungs. Right. Okay. Intrapleural मतलब lungs. Then intra-articular कौन सा आया? Your articulating joints, knee joints,
Synovial
shoulder joints, huh? Your joints. And intraperitoneal usually deals with the peritoneum cavity. It's in animals actually. Okay. So this is the thing. This is usually for animals. Fine. So let us look at them one by one. So first coming to intravenous. All right. Now what you'll see here are the different layers of the skin. Okay. Different layers of skin you see. And ये एक slide में बहुत सारे MCQs. So first, deepest down you have muscle, उसके ऊपर you have subcutaneous, उसके ऊपर you have dermis and then you have epidermis. And epidermis में only you have your veins. You all should know veins are superficially present and arteries are present deep down. Okay, arteries इतना superficially present नहीं है. Why?
Because the pressure is arteries are high.
Yes, because pressure in arteries are high. Little cut on arteries, you will lose a lot of blood. Okay, arteries have positive pressure. Okay, that is why our body is made in this way. Veins में नहीं होता है. Okay. Now, अभी इसका although these injections are going in the different layers of the skin, but the reference site, okay, the reference site of injection is your skin only, correct? Skin के through ही देंगे, right? Even though you have to give in veins or you have to give in muscle, हम skin के through ही देंगे, reference तो वही हुआ. So the angle at which you are giving the injection is very important. Okay, the angle at which you are giving the injection. So if it's an intramuscular, you are giving it straight at 90 degrees. This is very important, all right? Subcutaneous 45, intravenous 25, and intradermal hai, so that's very superficial. Okay, that is 10 to 15 degrees. ये पतला सा layer epidermis है, ये dermis. Okay, so this is how you are giving, and the way the syringe is to be held. Okay, the way syringe is held is also very different. Okay, so these are the angles at which you will give, and also the needle gauge size will differ. Okay, there will be a difference in the needle gauge size. This you all need to find out. This is your one question of your assignment. The needle gauge size will be changing. And this is the IV infusion system. IV infusion system. ये setup देखा रहेगा ना in movies or somewhere in hospital images and all of that, right? How a patient is lying down and this is how the infusion is given. Okay, so even this is inserted at 25 degrees angle only because उसको जाना तो intravenous ही है. Understood? Hello?
Yes,
Yes,
ma'am.
ma'am.
Yeah, okay. Then next is administration in vascular system. हमने पहले कौन सा system देखा? All your dermal layers. Now in vascular systems. So इसमें तुम्हारा again you have IV, you have intra-arterial and you have your intracardiac. So one-on-one comparison करते हैं. Intravenous में हम 1 ml to few liters देंगे. 1 ml मतलब if it's small volume, okay, small volume parenteral है, SVP है, that is few ml and that is in form of a bolus. Okay, that's in form of a bolus injection. वरना लीटर्स में जैसे मैंने बोला देना है तो वो इन्फ्यूजन है, ड्रिप सिस्टम से हम दें. इसमें रिस्क इज थ्रोम्बोफ्लेबाइटिस and because it is going in the IV system directly, you cannot give a water in oil emulsion or a suspension. Yes, you can give an oil, you can give oil in water emulsion, जिसमें water is the continuous phase and oil is suspended. Oil droplets are suspended or dispersed. But water in oil नहीं दे सकते या फिर suspension नहीं दे सकते. Suspension में तुम्हारा particle size and all that बराबर नहीं रहा, then it can cause the cloggage of your veins. Okay, thrombophlebitis and all that it can cause, even in case of water in oil emulsion. Okay, so you give oil in water emulsion. One important point to remember, जो भी तुम्हारा ये nanoparticles, NDDS systems होता है ना, novel drug delivery, nanoparticles हो गया, liposomes हो गया, okay, micelles हो गया, these can be given IV route से, IV route से उसको दिया जा सकता. Okay, this is about IV. Then is intra-arterial. Intra-arterial is usually given to premature infants because in that First of all, it is very difficult to locate an artery because they are situated deep down. We discussed why. Okay, because they are under positive pressure. So intraarterial is used specifically in case of infants, जहाँ पे it becomes a little easier to locate, or in case of anti-cancer therapy, especially in liver cancer therapy. But this is a very risky system. It's more risky than IV because you are dealing with arteries. Little mistake, you will lose, patient will lose lot of blood and उसके वजह से death भी हो सकता है. Okay, and obviously it is more invasive. Fine. So this is about intraarterial systems. Intracardiac mein administration is directly in the cardiac muscle, as the name suggests, directly in your heart. Okay, especially in the ventricles. Ventricles pata hai na? These two are atria and these are ventricles, correct? Hello. Are you all sleeping?
No, ma'am. No, ma'am.
Thanks. So here the example is adrenaline solution shots. Again, this is in case of emergency situation. Okay, intracardiac. Intracardiac is also given in some cases during bypass surgeries. Okay, open heart surgeries में भी कभी कभार देते हैं. Clogs and all that removal. So these are administrations in vascular systems. Is everyone keeping up with me? Am I going fast, slow? समझ आ रहा है सबको?
Yes, ma'am. Yes, ma'am.
Okay, good. The girls, I can just hear the guys. Malika,
Yes, ma'am.
Kanshri,
Yes, ma'am.
Yes.
I hope you all are understanding and you all are keeping up to things, okay? After today's lecture, please go and read Remington or Alton. These are the two books which you all have to refer for this chapter. कौन सा? Remington and Alton. Do you all have हाँ, ये books का access होगा तुम लोग के पास. नहीं होगा तो let Pritam know. I have those books. I will send it to you all. Okay. So जो भी आज का टॉपिक हमने पढ़ा है, revise it through the books. मैं PPTs भी भेज दूंगी. And come up with the doubts in the next class. All right? Yes.
Okay.
Yeah.
Yes, ma'am.
Okay, ma'am.
Yes.
Because this is a vast chapter, बहुत important MCQs है, but it's easy to learn actually. Okay? So अभी के अभी पढ़ लेते हैं. Pharmaceutics, all the topics which I am teaching, they are very important, but they are easy to learn. So I want you all to spend more time on volatile subjects like pharmacology, pharmacognosy, chemistry. जिसमें you need to constantly remember the names and all. These are very much conceptual based. So अभी अच्छे से पढ़ लो, तभी you just have to revise things. Got it? And how are your tests of Sutix and all going on? Hello. Test का बात करते तो this अचानक सन्नाटा in the class. How are your tests and all going? Suraj, Shubham, Yogesh.
ठीक जा रहा है.
ठीक जा रहा है. ठीक is like अच्छा कि बुरा.
Okay.
Yes, ठीक. Okay.
If you all have any doubts, I think there are students of Dadar and Thane branch as well over here. Right?
Yes.
Yes, ma'am.
So if you all have doubts in test questions, okay? Test questions में तुम लोग को doubts है, especially related to the topics which I am teaching you all, please get back to me. Doubts के साथ मत बैठे रहो. It is going to cause problem later. Any doubts? Ask me now only. Fine? And what am I going to do from next time whenever we meet in between, if we have a lecture, if you all have a test, I'll discuss the test paper with you all. Do you all want me to do that?
Yes, ma'am.
Yes.
Yes, ma'am.
Till then, Next class अपना I think next week होगा on 17. So come up with doubts and all of that. Fine. Yeah, let me move ahead now. You can see the slides changing, no?
Yes, ma'am.
Yeah. So now we'll look about the skin and the muscle layer. Again, the same, intradermal and all of that. So please understand this. This is a very important diagram. Deep down you have muscle. उसके ऊपर subcutaneous. Subcutaneous में तुम्हारा fatty adipose tissue ज्यादा होता है. Adipose tissue. Muscle में obviously you have your muscle tissue. I'm sorry. You all can see the slides, right?
Yes, ma'am.
Yeah, here you have your muscle tissue. This is your subcutaneous tissue. Subcutaneous में तुम्हारा adipose tissue ज्यादा होता है, and there you have your this thing also, your lymphatic system. Wrong with the pen. I'm not able to write, so just make a note. Adipose tissue, subcutaneous में तुम्हारा lymphatic system ज्यादा होता है. So when you want to administer some lipophilic system or lipophilic drug delivery system, oil-based drug delivery system, you will administer in subcutaneous tissue so that it can be uptaken in the lymphatic system. All right. Then you have your dermis. Then you have your hypodermis, and this is the epidermis. Okay. So intradermal is the layer between the epidermal and administer between the epidermal and the dermal layers. So इधर तुम बीच में administer करते हो, and this is the volume. Up to 0.2 ml तुम administer कर सकते हो. मतलब बहुत कम volume तुम administer कर सकते हो. It's just 0.2 ml, and the absorption through this layer is slow, and it is basically given for vaccines like your BCG vaccine, or it is for your immunological diagnostic tests in case of tuberculin protein or allergy tests and all of that. Okay, so for these things it's given. Please take a note of the volume which can be administered. Okay. The next is your subcutaneous. It is administered in the hypodermis. So this is only your thing, subcutaneous layer or your hypodermis. So this is, I'm sorry, this is the hypodermis, dermis and epidermis. इसमें थोड़ा ज्यादा वॉल्यूम हम दे सकते हैं 1 ml. Okay, aqueous solution, suspensions, also non-aqueous, also oily based system हम इसमें दे सकते हैं. Rapid absorption, and the very go-to example for SC is insulin. जो तुम insulin देते हैं हम patients को, that's given in your subcutaneous. And the next is intramuscular. Even intramuscular is used for aqueous to oily solution suspensions. तो तुम intravenous में suspensions नहीं दे सकते हो, SC और IM में suspensions दे सकते हो. Intravenous में oil based नहीं दे सकते हो, but IM में दे सकते हो, and SC में भी कभी-कभी हम देते हैं. Okay, and ID and IM are slow absorptions. SC is rapid absorption, probably due to the presence of lymphatic systems in it. Okay, so it is administered in muscles, your gluteus or deltoid. Okay, your thigh muscles, upper arm muscles, your buttocks, and here the volume is even more, 4 ml. So जैसे हम deeper down the layers जाते हैं, we have the liberty of administering higher volumes of formulation. Is it clear, everyone? Hello.
Yes, ma'am.
Okay. Next is the CNS based system. So first is the intraspinal administration. As the name suggests, it's given in the spine. Okay, only aqueous solutions are given. Why? Because तुम्हारे spinal cord में भी जो fluid होता है, which is that fluid present in the spinal cord?
CSF.
Yes, CSF. And CSF का भी it's kind of like plasma only. It is a water-based fluid. तुम्हारा blood is also water-based, correct? Blood का major component is plasma and plasma is aqueous, right? Similarly, CSF is also aqueous. It has more water content. And because it has more water content, you can only administer aqueous solution. And CSF माने दो वर्टिब्रे के बीच में देते हैं. स्पाइनल कॉर्ड में जो वर्टिब्रे होते हैं, दो वर्टिब्रे के बीच में इंजेक्ट करते हैं. All right, here you see. This diagram, if you can see, ये दो वर्टिब्रे के बीच में इधर किधर दे रहे हो. Okay, in the spinal cord, lumbar vertebrae में दे रहे हैं. And very important to know is that intraspinal injection के वक्त the patient should be lying in supine position. Supine position मतलब लेटे हुए होने चाहिए, and they should bend. Okay, either लेटे हुए होने चाहिए या bend, लेटे होकर ऐसे bend होना चाहिए. Otherwise, even if they are standing, they should be bent so that you know that vertebrae is a little exposed and it's easier to administer. And giving intraspinal injections are very difficult and it's painful also. Okay, because it has to go deep down. All right, very meticulous job. So this is intraspinal injection. Then is your intrathecal injection. Even this is administered into your CSF. Okay, in the subarachnoid space between your arachnoid matter and the pia matter. So this is again your spinal cord and it's given somewhere here in this region. तुम्हारा जो ये pia matter है, pia matter and arachnoid matter के बीच में जो ये subdural space है, okay, subarachnoid subdural space है, वहां पे you are giving intrathecal injection and the volume is a little more. It's up to 10 ml you can give, especially for spinal anesthesia or drugs to reach the CSF. In case of anti-cancer, okay, anti-cancer मतलब तुम्हारे meningitis and all that के time, मतलब brain cancers and all, वो time पे इस जगह पे देते हैं. So it's within the spinal cord. All right. Then is intracisternal injection. Intracisternal injection is given here near the cerebellum. Cerebellum है ये, correct? Your small brain, cerebellum. उसके बीच में ये जो space है, this is called as cisterna magna. So यहाँ पे दिया जाता है between the atlas and the axis vertebrae. तुम्हारे neck के उधर दिया जाता है, right? And for antibiotics, again, CSF के अंदर जब administer करना है, again, this is for meningitis or brain-related fungal infections and all. To withdraw CSF for diagnostic purposes, तो इधर से दिया जाता है. This is relatively easier than your intraspinal. And then your epidural injection. But जो epidural में दिया जाता है, that can be given in form of injection also, infusion also. दूसरा injection infusion कहाँ दिया जाता है? IV में, intravenous. Okay, और इसमें epidural injection infusion. Administered in the peridural space between the dura mater and the vertebrae. Okay, for spinal anesthesia during childbirth. Okay, ये इतना ज़्यादा common नहीं. These two are more common. Which one? Intrathecal and intracisternal. Got it, everyone? The 4 administrations into the CNS. Here, what you'll have to remember mostly is कौन से region में दिया जाता है? Intrathecal between the pia mater and arachnoid matter. Epidural between the dura and vertebrae. Intracisterna is in the cisterna matter. Got it? Everyone?
Yes, ma'am.
Yes.
Yes, ma'am.
Okay, fine.
Yes.
Then is your intra-articular injections. Okay. Intra-articular injections, as I told, it's given in the articulating joints. Articulating joints का मतलब I hope you all know. It's a ball and socket kind of joints. Yeah, it's something like this. Okay. So yeah, these two are the points and this is the joint and this is the synovial fluid. This is called as the synovial cavity and usme you have synovial fluid. And ये तुम्हारा cartilage को, it's basically as synovial fluid acts as a lubricant. It acts as a lubricant. And what happens is that when there is a very high deposition of urea in your body, okay, it deposits here, okay. So synovial fluid now, it's actually very gel-like, okay. It's basically lubricating. Now, so it's soft and gel-like. But because of high urea deposition, तो my body में uric acid जब बढ़ जाता है, it deposits in form of urea in this cavity. So what happens is that ये जो soft gel-like होता है, it starts becoming hard. Okay, it starts becoming hard and harder. All right. So वो movement easily नहीं होता. This is what happens in your which disease? Arthritis, inflammation and all that होने लग जाता है. It becomes very hard. It becomes painful to move these joints, knee joints, elbow joints, your girdles here. All right. So it becomes very hard. So synovial replacement therapy होती है, जहाँ पे वो जो भी हार्ड हो गया है उसको निकाल के फ्रेश synovial fluid भरा जाता है. Otherwise, there are some medicaments which are given जो ये uric acid को break down करे and again जो हार्ड हो गया है तुम्हारा synovial fluid उसको वापस से soft and बराबर से करे. Okay, so that is what is happening. So it is given in intra-articular injection, given in the synovial fluid of the joint cavities, and these are aqueous solutions or suspensions. And it's used for anti-inflammatory drug producing local effect, arthritic conditions, or sports injuries. Did you all get this? Everyone?
Yes, ma'am.
Yes.
If you all understand, I'm teaching you all, or I'm trying to give you all more information than just जो तुम्हारे parenteral में है, with respect to this anatomy and all that also. So please take a note of these things, okay? ये तुम लोग को as such pharmaceutics की textbooks में नहीं मिलेगा. Fine. And synovial fluid has a very peculiar rheological properties. Thixotropic property. ऐसे it is gel-like but movement होता है तो वो fluid type हो जाता है. Because when you're giving movement of these joints, you are applying shear, and when you apply shear, thixotropic system gel to sol बन जाता है. So that is what is happening. So I have my colleagues who work on these. They work on some joints and all. They are in mechanical engineering working on joints and all. So when they are preparing synovial fluid for simulation purposes, rheological property becomes very important. Okay, and they add hyaluronic acid. Okay, they add hyaluronic acid to maintain that viscosity. Okay, or rheological property. Let us move ahead. Coming to intraperitoneal injections. Have you all made note of intra-articular?
Yes, ma'am.
Intraperitoneal is given in the peritoneal sac. मैंने बोला animals में. When we do animal studies here, when we have to give some injections, we give peritoneum. उसको mouse को ऐसे पकड़ते हैं. We like pinch off the skin, belly area से, and then उधर injection देते हैं. So peritoneal is nothing but a sac which covers your GIT. Okay, जो पूरा GIT होता है उसको एक sac जैसा cover करता है, which covers that. That is called as your peritoneal cavity. and absorption is less rapid than IV, obviously because it's not going directly in the bloodstream, indirectly. And intrapleural is very important. This is the one which is given in lungs, okay, in the pleural space through your chest wall. Very rarely used for lung emphysema and all of those cases. Antibiotics diye jate hain, penicillin. So here you see this is your pleural cavity, right? So idhar diya jata injection. Okay, in the pleural cavity. Now coming to ophthalmic injections. These are injections and not eye drops, okay? Here you see the eye drops. Eye drops are classified under topical systems. But these injections, intracameral, intravitreal, and periocular, or also called as subconjunctival. These three type of injections come under your ophthalmic injections. And then you have something called as okay, and then you have systemic implants. So these are three different things which are given in ophthalmic. You have topical, you have parenteral, and you have these systemic implants. All right. So ophthalmic में you have intraocular, मतलब आंख के अंदर दिया जाता. So that is intracameral, which is given in the aqueous humor. Aqueous humor में दिया जाता है here. This is your aqueous humor, correct? Aqueous humor में intracameral दिया जाता है and intravitreal is giving in here in the vitreous humor. And these are again aqueous solutions. And subconjunctival is given in the conjunctiva of the eye. And these are the volumes, less than 1 ml, less than 0.1 ml, and intracameral is 0.1 to 1 ml. Got it? Isme the important part to remember here is the volumes. Okay? Did you all understand?
Yes.
Yeah. So here, then we have different types of formulations. Okay? Different types. Ye to different routes of administration. Now we have different types of formulation. You have normal solution. Okay? Solution may you have solution which are ready for injection. Matlab they are already in soluble form. Directly inject karna hai. Otherwise you have a dry soluble powder. Okay? Dry soluble powder hai. Usko tum reconstitute karo. Okay? You reconstitute it with some solvent. You reconstitute it with some solvent just before use and then administer. Okay. So end product दोनों का solution ही है. And these are usually lyophilized product. ये तुम्हारे freeze dried products होते हैं या lyophilized product. Very good example of this is remdesivir injection. Remdesivir का नाम सुना है?
Yes, ma'am.
कहाँ सुना है?
Coronavirus.
कोविड के टाइम, यस, जिसके लिए मारामारी हो रही थी ना इंजेक्शन के लिए, इट इज दैट रेमडेसिविर इंजेक्शन. सो रेमडेसिविर इंजेक्शन इज एक्चुअली अ लायोफिलाइज्ड पाउडर. वो वायल में आता है, फ्रीज ड्राइड पाउडर होता है, उसको रिकॉन्स्टिट्यूट करते हैं. ओके, रिकॉन करते हैं विथ वाटर फॉर इंजेक्शन और स्टेरिलाइज्ड वाटर फॉर इंजेक्शन से करते हैं. Sterilized water for injection से recon करते हैं and then it is administered to patient. So one again general knowledge point here is इसको why was there a shortage of remdesivir injection was that because of its production. इसके production को बहुत time लग रहा था because lyophilization is a long process जिसमें production को time लगता है. Okay, so that is why it took time and that is why there was a shortage. All right, so the first one is solutions. or powder for reconstitution, which at the end forms a solution. Then you have suspensions, straightforward, okay? Even suspensions are directly used, fine. Emulsions, even they are directly used. It can be oil in water, water in oil, okay? Parenteral में दोनों दिए जाते हैं, but IV specifically में ये दिया जाता है, oil in water. Then like you have solutions का dry version you have, वैसे suspension का भी dry version you have. Dry and insoluble product. Solution में you have dry and soluble product. Suspension में you have dry and insoluble product which is to be reconstituted with a vehicle. So इसका end product, इसका reconstitution करने के बाद you will form a suspension only. It will form a dispersion. Okay. So powder for reconstitution जो होता है, it can either form a solution if it is soluble. If it is insoluble, it will form a. If it is insoluble, it will form what?
Suspension.
Suspension. Okay. And then you have liquid concentrates which are ready for dilution. Okay. ये emulsion का भाई होता है. Or you can say a concentrate. It is concentrated, you have to dilute it. या फिर for example oil in water का भी concentrated form है, you further need to dilute it. Okay, these are simple liquid concentrates which has to be diluted. So these are the 6 different types of formulation. And then you have these novel system, nanoparticulate systems, which is nanoparticles, liposomes, and all of that. They are colloidal in nature. Okay, so they are basically dispersions only. Colloids are nothing but dispersions, right? So they are dispersions. So yeah, these are the pharmacopoeial classifications. You have injection, which can be a single dose injection or a multi-dose vial you can have. Single dose में तुम्हारा ampule आता है. Multi-dose में तुम्हारा vial आता है. Okay. Then you have your infusion, जिसमें तुम्हारा IV bags आता है. Okay. Dilution bag. Or you have your IV bag. Fine. Then concentrates which are to be diluted. Okay. Dilution करने के बाद either उसको bolus form में देंगे और infusion form में देंगे. Similarly with powder for reconstitution. It has, you don't say it has to be diluted, you say it has to be reconstituted. And again, that can be given in form of a bolus or in form of an infusion. Okay. So yeah, this is the thing. This is a very short note. These are the different ampules. Okay. Is everyone still there?
Yes, ma'am.
Yeah.
Yes, ma'am.
These are the different ampules here. Amber colored ampule. This is amber colored ampule. Okay. This one is tinted ampule. These are clear ampules. Then these are pre-filled syringes. PFS बोलते हैं या फिर cartridges बोलते हैं. Okay. These are your this becomes a type of your complex drug delivery systems. Okay. PFS and cartridges. So in what cases you must not use a preservative? Okay, this is very important. Preservatives obviously are a very important part of an injection system. You all understand why. Okay, because it has to maintain sterility and all of that, right? So कौन से cases में हम preservatives use नहीं कर रहेंगे in parenteral system? First, when the volume, when it's a single dose thing, okay? When it is a single dose product, okay? तभी we do not use. The volume to be routinely administered in a single dose exceeds 15 ml. Okay? Either if it is a single dose, तभी we may skip using a preservative, or a single dose जिसका volume is more than 15 ml. Okay? Then you do not use preservatives. Then in case of ophthalmic injections, you can avoid, और CNS वाले रूट में जहां पे CSF में जाता है, like your cisterna, epidural, intrathecal, in those cases you needn't add preservatives. Okay, and instead the unpreserved injections should be presented in a single dose containers, जैसे मैंने बोला ampule of pre-filled syringes rather than vials. Ampules, you know ना, they are sealed, you cut it off, take entire product and inject. Pre-filled syringe में भी वो already भरा हुआ होता है. Okay, vials में क्या हम एक vial में से 2-3 बार निकाल सकते हैं, correct? So in those cases you needn't so if you're going with an unpreserved thing, it should be filled in ampules or PFS instead of vials. Then single dose में जरूरत नहीं है. If it exceeds more than 15 ml, तभी preservative जरूरत नहीं है. And ophthalmic and CNS वाले में जरूरत नहीं. Got it? Then infusions here. Infusions, yeah. Then coming to infusions, these are your drip systems here. Okay, if you can see here. Okay, so infusions are again sterile aqueous solutions or emulsions which are oil in water. Okay, so aqueous or oil in water. Example is your TPN. They have to be isotonic because it's given over a period of long time. तुम्हारा जो पहले वाला था ना normal injections या फिर जो bolus होते हैं ना, उसमें isotonicity plus minus हुआ चलेगा. But infusion में isotonic होना is compulsory because it is a large volume parenteral. तुम एक साथ बहुत सारा administer कर रहे हो. That is why infusions must be isotonic. And उसका large volume parenterals मतलब कितना होता है large? 100 to 1 liter. It can also go a little more to 1.5-2 liters. Okay. A large volume parenteral ka volume is 100 to 1000 ml. And again, they do not contain microbial preservatives. I said na 15 ml se agar zyada hai, then it needn't contain preservatives. All right. So these are some important points about infusions. So do you all want me to continue or should we end here?
And ma'am.
Shubham wants to run away. Okay, so what we'll do is we'll end here. All right. Next class. So whatever I've taught you all, did you all understand that?
Yes, ma'am.
Okay. So next class, we are going to start with the different components. Okay, in that excipients हम पढ़ेंगे and packaging system also, if possible, we'll study that. Last lecture, we will study about the isotonicity and all of that, numericals and all. Okay, so next lecture we'll be having on 17th. Okay, so then we'll finish off this much part. Fine. Any doubts now? Hello. Hello.
No, ma'am. No doubt.
Okay, so we studied what are parenteral systems, characteristics, advantages, disadvantages, then the different routes, different types, and what are infusions and what are injections. Preservatives कब use करते हैं that, and what are the properties of your preservatives कब नहीं use करते that, and what are the properties of your this large volume parenteral. All right, so I'll post the assignment questions by tonight or tomorrow. You all have to submit it to me by Wednesday so that next Saturday tak I can correct that and we can discuss. All right, chalo. Bye bye. Good night. Take care and revise the topic. Okay. And
Thank you,
next
ma'am.
class, at the start of the class, we'll solve some MCQs. Okay. Bye.
Thank you, ma'am.
Yeah. Thank you.
Thank you, ma'am.